Welcome to the Medical Collective, your go-to podcast where medicine meets real life. I'm Dr. Keisha Davis, a pathologist, personal trainer, and your host. I will be joined by a vibrant team of doctors who are not just healthcare professionals, but artists, fitness enthusiasts, and advocates for change. Each episode, we dive deep into the world of medicine, from untold stories of the healthcare industry to the latest in medical advancements. We're here to bring your insights, answer your burning questions, and explore the art and science of healing. So let's get started and step into the world of the Medical Collective. Hello, everybody. Welcome into the Medical Collective. I enjoy coming here to talk to you all, and it's always something important. But today, I'm going to take you into the microscope room. I'm going to take you into my office with this conversation. One of the questions that I get asked all of the time is, why did I become a pathologist? People assume it's because I like looking through the microscope, and I do. When my son was little, I took him into the office when I was training, and he called it the look of things. He called it the look of things. So cute. So I still tease him till this day about that. But it's really simple. I watch true crime a lot. I love to solve mysteries. I do. I love detective stories. I love true crime. I love taking clues and trying to put together and connect and find a story. This is what I want to talk about. The difference is that instead of fingerprints, shoe prints, or DNA at a crime scene, my clues are laboratory tests. They're also the information that I get from the physician on the requisition. They're also what I see under the microscope with the biopsy, the organisms that we also see, one abnormal lab result. They're all clues that are tying to a bigger picture. Every diagnosis begins with a clue. And one of my favorite things about pathology is that we rarely stay at one magnification. We use three. I'm gonna put them into three objectives, is what we call them. Sometimes we're zoomed all the way in, looking at a single organism. Sometimes we're looking a little bit out at medium power when we're looking at the patient. And sometimes we have to pull all the way back to what we call low power, and it's surveying everything. And that's when we're looking at it in the respect of the community. So today I want to use that same approach to solve one of the biggest medical mysteries that's making headlines right now that we're hearing about. And that's regarding Cyclospora, or cyclosporiasis, which is the disease that it causes, which is this explosive watery diarrhea. And it's more than just this one parasite. We will find out in this episode. So come with me. Let's start where pathologists usually end, under the microscope. We're going to start at high power. We're actually going to zoom in and talk about the organism, which is Cyclospora. When most people think about food poisoning, they automatically think about bacteria and viruses. For instance, you may have went to a picnic, had some potato salad, and 6 hours later, you're not feeling so great, and you think back, what did I eat? The potato salad? And then you think about, okay, I probably had, salmonella infection or E. coli infection, depending on the food. Cyclospora is a parasite. It's a protozoan parasite. It's the only species of Cyclospora that infects humans. So we're it. We're the ones that it likes to host on. Now, there's other species that are found in animals, but Cyclospora cayetanensis is the one that's responsible for human disease. It's important because it tells us something about this organism, how it behaves. I always talk about, how do these organisms behave? Where do they like to be? Where do they like to live? Unlike in bacteria that just divides, or viruses that hijack your cells, parasites have these complicated cycles. They mature, they change forms, they reproduce in stages. Some of those stages happen outside of our body, and some of them occur inside. And I think understanding the life cycle is why we understand why it's so tricky to catch up with it in time. Now, the first part is the oocyst. This is the protective shell that I think about it as a shell or an egg or a tortoise that likes to hide. And when it's hidden, you can't really get access to it. That's the oocyst. This is the form that's outside of the body. It survives long enough in the environment that it can contaminate food and water. So it can live for a long time because of this shell. This is one of the reasons that fresh produce becomes such a challenge, is because these microscopic oocysts can adhere to foods like, now you're not going to like this part because a lot of us that are plant-based or eating healthy or doing our raw food cleanse, it's the foods we like. Cilantro. Well, my husband is not a fan of cilantro. I'll have to share that story some other time. Basil, lettuce, raspberries, blackberries, snow peas. Yes. And unlike bacteria that sits loosely on a surface and we can wash it off, these parasites are difficult to remove completely. That's why people say just rinsing your fruits and vegetables is not going to get this parasite cyst, the oocyst, off of it. It cannot guarantee elimination by the simple measures we usually do at home before we eat these fruits and vegetables. Now, I'm not telling you to stop eating fruits and vegetables. Please. I would be the last person to tell you that. But I am telling you to understand why this parasite is different. The biology matters. So after you ingest it, the oocyst, right? That thing that's stuck fast. You washed that fruit and you were so good and vigilant and you ingest the oocyst. And it goes into the small intestine. So think back to biology. You have two main parts. You go through your esophagus. The food goes through the esophagus down into the stomach, and then it's got two intestines, the small intestine and the large intestine. Now, the small intestine is where this parasite likes to attach. Your body absorbs nutrients, vitamins, electrolytes in the small intestine. And the small intestine has fingers. I think about it like fingers because this allows for absorption of nutrients based on those fingers. And you've heard of celiac sprue, right? Where, and in that disease, your fingers get denuded. So they get cut off through the inflammation and all of that so that you don't have the same absorptive surface. Inside the small intestine is where the oocyst, now this Cyclospora, likes to attach. It attaches and then it invades into the lining of the villi and it reproduces here. So this is where the damage happens. It goes inside and then it does its replication cycle. And this also, it's a cycle. So there's a cycle of life that you have the replication, and that's when you feel the pain and you have the watery, explosive diarrhea. And then when it's not an active cycle, you feel better. And this is literally why many people that have cyclosporiasis can be sick for months if they're not treated, because they have the diarrhea. They think they're getting better, and then they're not. So you have to get treated, but that requires making sure that's what you have. These parasites, they play by different rules. One thing I think that is fascinating about parasites is that they don't always behave like bacteria or viruses. We wish they did. Because of this complex life cycle I'm talking about, there is this cyclical reaction to your body. Think about malaria. Malaria, what is one of the things you hear about people with malaria is they have a fever that comes and goes, an undulating cyclical fever. They feel fine, and then all of a sudden they're down and sick with the fever. Then they're better again, and then they have a fever again. Now, Cyclospora isn't identical to malaria, but it reminds me of that and how these reproductive cycles are what is causing the fever, the problems, and then getting better. I hope that makes sense. And it can fool patients. This is why you feel better for a while, so why go to the doctor? And then you get sick again. And you're like, well, wait a minute, though. Maybe it's really not anything. And you start to question yourself about your symptoms. So important. Parasites don't always make you sick once. They sometimes live through this cycle, and the symptoms and your body goes through it and starts to make you think you're crazy, and you're not. So we're going to start solving that mystery of what it's causing my problems and why Cyclospora is so mysterious. Now we're going to medium power. We're backing up a little bit. We talked about the parasite. And by the way, I will have some pictures on social media that you can see of what this looks like under the microscope when I see it. Yeah, very, very nice. And also something about the diagnosis of it, too, is that when we're looking close up, it may not be the easiest thing to see because it's sneaky. So now medium power, we're backing up a little bit. Every outbreak leaves clues. And when it leaves clues, that's when doctors investigate. If we're seeing more people in the hospital, we've got to investigate. One of the first clues is timing. It's timing. When you go to a church picnic and you have that potato salad, and everyone ends up saying, you know what, I got sick last night. You go back and you start to investigate it. Or for those of you that like cruise ships, you're on that cruise ship and then the next day you're supposed to meet up and go dancing with Sally, Joe, and Bob. And they don't show up because they're all sick. Those are the clues that you know that it's something that you all ingested. And you look, is it staph? Staphylococcus, some of them have a toxin they produce. Is it Clostridium? Is it Salmonella, especially if it's poultry or eggs like the potato salad? Is it norovirus, which is common on cruise ships as well? Those are some of the clues. Hundreds of people touching the same buffet utensils and you accidentally touch your face and hours later, you're sick. A day or two later, you're sick. Hello, listeners. We want to remind you that you can catch The Medical Collective on all your favorite podcast platforms. That includes Apple, Spotify, and YouTube. Be sure to hit that subscribe button so that you never miss an episode. We're also on Libsyn, and you can find us on all social media platforms as The Medical Collective. Do you have thoughts or questions? Please don't hesitate to reach out. We love hearing from you. Now let's get back to the conversation. So the pattern is telling a story. The timing is telling a story. But Cyclospora does not have a timing. It doesn't behave or listen to our rules, kind of like my daughter. Sometimes doesn't listen to my rules. So instead of 6 hours or 24 hours, the incubation period is longer. It's up to 2 weeks. And the incubation period is the time from infection or exposure to something to where you actually have symptoms. So 6 hours, 12 hours for some foodborne illnesses, up to 2 weeks. So 7 to 14 days incubation period. Who remembers where they were, every place they were, and everything they ate from 2 weeks ago? It's not just exactly a 14 days. You have to remember everywhere you went. So if you're looking at a group of different people in different places and maybe they traveled, it's hard to now pinpoint what exactly is causing everybody to get sick with Cyclospora. What we know people have Cyclospora after the testing, but what? That's why we can't pinpoint one thing causing all of these outbreaks. I don't remember what I was eating. Now, when we get into this real mystery, now we know what it is, but in medicine, sometimes after you even identify what it is, the battle is, how do we prove it? And this is another thing that's fascinating about it. And this is where the conversation between the doctor and me, the pathologist, is so important. A lot of doctors will tell you, go ahead and give me your stool sample, right? You have diarrhea, let's take a stool sample. I know you all, that's not the fun part of collecting it, but we welcome everything in the lab. We're the one place in the hospital where everything is welcome, and especially stool, because we know how to take care of it and process it. When you have a stool sample and the doctor orders what is called O&P, which is ova and parasites. Now here's the problem with this sneaky little thing. When you are ordering O&P, we look at it and sometimes Cyclospora is missed because the traditional O&P and the staining that is used does not detect this sneaky thing. Acid-bath staining or UV light is needed to find it. So if you just order O&P and we're nothing in the lab, we're just going to do that test that was ordered and do it. Now, if you go to the doctor and say, I heard about this outbreak of Cyclospora, or, you're in Michigan where they're having a lot of cases and hospitalizations, and you're like, well, I've had this for a long time. It wasn't just, a couple of days, like a E. coli infection or something, and it's now been 2-3 weeks, doc, and I'm still having these diarrhea. then they might think, okay, maybe it is Cyclospora. Then they may be apt to order the additional testing. There's even some panels that are ordered on respiratory diseases and on intestinal diseases. However, even in some of those panels, Cyclospora is not commonly on there. Yeah, so that's where it gets tricky. We know that you have this persistent reoccurring diarrhea in your first test. Remember again when I had the conversation about normal test, doesn't that mean you're normal? You still have diarrhea. So even though the fecal O and P is negative and the bacterial test, the toxin test for C. diff, it's all negative, we need to go deeper. And what can that test miss? And one of the things those basic tests can miss, the screening test, is Cyclospora, right? Could it be bacterial? Could it be viral? Could it be inflammatory, autoimmune, or IBD, or parasitic, those sneaky parasites? So that's something I hope doctors that are listening that you think about that too in the testing, that could be missing. Very important to not forget that. And the UV, which is the ultraviolet autofluorescence, naturally fluoresces this. So under this UV microscopy, we can see it. But again, it has to be ordered. Same thing with molecular GI PCR panels. You can say I ordered a panel, but what's on that panel at your hospital? Not all hospital labs have the same panel. So tests are wonderful, but we have to know what's in that test. And sometimes it's okay. There's a new push for pathologists in laboratory medicine to be able to kind of suggest and help guide physicians when things may be more difficult. We understand testing. So we can say, you know what, you might want to think about this. You might want to order this. So important. This reminds me of something that I've talked about before, and I've just mentioned to you all, is that when people assume, and I hear it so much, but the doc said my tests are negative, but the doc said everything's fine. And then I'm thinking in the back of my mind, what could have been missing? What could have been missing? And laboratory testing is so intricate that even some of the general doctors don't understand everything that happens in the laboratory. So ask. We have to choose tests. We have to be cognizant of what are we missing. We did tests, but what are we missing? So that's the important part. We can't miss it. Now, Cyclospora can be cyclical. It can come out. It can attach to our fruit and it's in our body. Now we have to test it so we can treat it. And one thing about treatment is that Cyclospora isn't treated the way many other are. Supportive is, yes, important, but Bactrim. Bactrim is the method of treatment. And people will say, but Dr. Keisha, you told me that antibiotics are only for bacteria, right? And that for virus infections, we don't usually treat them unless we need an antiviral. And now parasitic, there's antiparasitics, but Bactrim works against the parasite. It depends on the metabolic pathways involving folate synthesis. Okay, so the way that this parasite works is that if you use Bactrim that inhibits or blocks those pathways, then you're going to kill off the parasite, which is a great thing. It's an amazing thing. It's the way medicine works. Not everything fits in a box, but getting to that step is the problem, right? We have to get to diagnosing it so that you can get the right treatment. Now, we've looked at this parasite and high power. We zoomed out and looked at you as the patient in the laboratory. But what's still missing is diagnosing one patient is not the same as an evolving outbreak. And that's, to me, truly, every step of the way something is missing from this picture or this parasite, which is trying to be the perfect parasite, right? This parasite has the recipe for disaster. And where we can reel it all in, the parasite can do what it's going to do. But if we have the right testing, if we are able to diagnose, we've got part of the picture. But now we got a public health issue. Every year, there are cases of Cyclospora in the spring and summer because that's how the parasite is. Now, this year, the numbers are much higher. Instead of 50 cases, we're seeing 300 cases. It's a problem. But we've got to have things in place that help prevent that, right? We have to solve it. We have to think like an epidemiologist. We have to think like the FDA, how they should be, and the CDC. And that's where we now think about solving this. How are we going to solve this? It's a notifiable disease, first of all. So when people get Cyclospora, what doctors should be doing is notifying. They should be notifying their public health department so that the correct people are relayed this information. And you know what happens? It keeps going down the chain of command. So you're dealing on a local level to a state level and now to a national level. Now, if part of that chain is broken, what happens? You get it delayed. Right now, with the FDA and CDC, we know thousands of people have lost their jobs. We know that we don't have every department together. In 2019, there was a department put together called, or a board put together called the Cyclospora Advisory. And they were supposed to help because of Cyclospora outbreaks happening, right? We don't want people sick. However, there still is a Cyclospora Advisory Board, but I don't know to what extent. Right now, it's July 10th and July 1st. If you look, CDC is behind that far as reporting the outbreaks. Now, you can go and get the information, right, locally from your health department and then sieve through it. But if you have to do all that stuff, it's going to take time, which is leading to a time delay. So if you're finding out there's an outbreak and by the time you're 2 weeks into it, you're past. And now we're 2 weeks ahead as far as cases, hospitalizations, and trying to find the source. So this is why it's going to be so hard to find the source. If Michigan reports several cases, in Ohio, then Texas, and then public health officials are asking about travel and stuff, and we're delayed, that's important. So we got to look at travel, we got to look at produce, and then produce goes quick off the shelves. So again, if you are 2 weeks into getting symptoms after exposure, the produce is already gone. How are we going to find it? So we're not trying to just solve your illness. We're trying to solve and prevent many more. That's what public health does. So this trace back is very difficult. I hope you guys understand that. I remember the Jack in the Box, and this was a long time ago. I was in college. I remember the Jack in the Box outbreak, but it was so quick. Everybody got sick, and within 24 hours, they found the source of it. And it's so simple, but not everything that's simple. So when it is more intricate, it's more difficult and delayed, we've got to start thinking more. It just does. Now, I do want you guys to think about something. I don't want you to be scared away from cilantro, raspberries, blackberries, lettuces, all the things that can have Cyclospora, okay? I want you to also know that there was a task force and that we do have the infrastructure. We need to rebuild it. We do need to rebuild it. And this is so important, why public health infrastructure. I hope, if anything, this makes you think, oh my gosh, what do I do? That's actually the next thing. What can you do? Should I stop eating salads? No. But what we can control, again, is washing your produce. So important. Following FDA and CDC when they're intact and doing well, but following CIDRAP. There's so many other sources. The Medical Collective website has a trusted health resource page for you for that. If you develop a prolonged watery diarrhea, go to your doctor and talk to them and tell them. This is where stories matter. Give them so much information, they're going to be inundated. I'm going to tell you, because one thing in that whole story you give them is going to click, and they're going to be like, oh, this is probably parasitic. I'm going to tell you, the more information, the better. In the lab, I need more information from my doctors. The more, the better. That helps us. The second lesson that I wanted to share with you all is that a negative test is not always the right answer. Sometimes it means we ordered the wrong test, and we've talked about that. That's your second lesson. Lesson 3, parasites play by different rules, right? They have different life cycles, and if they are in that oocyst or cyst form, that's why they're evading immunity and the washing and the things that we normally do. There's different diagnostic challenges because of parasites, different treatments. Understanding it is so important. Lesson 4. Public health is a team sport. Listen, if you want to go do your own thing, go to a solo sport, but it's a team sport. And even some of the solo sports, if you realize there's people behind the scenes, like the pathologists, that are doing a lot of the work you don't realize. So even solo sports like one-on-one tennis or golf, they're team sports. They are. Outbreaks are solved by physicians, laboratories, microbiologists, scientists that are doing the research, state health departments, your local health department, the FDA, the CDC, agricultural experts, right? Because that's where the foods come from, epidemiologists. None of us solve these mysteries alone. It requires all of us. And that brings me to my next lesson, my last one. The more you understand how medicine works, what? The better partner you become in your own healthcare. Ask questions and stay curious. Understand why your doctor is ordering certain tests. And remember, sometimes this mystery takes time. So you may go to the doctor thinking, I'm going to go home knowing everything. It may not work like that. It may not work like that. Okay? And one of the reasons I love pathology is that every time I change the magnification on that microscope, I learn something new. I do. Today we started under high power with the parasite, the organism, one patient. We zoomed out to medium magnification, learning about the laboratory, right? The diagnosis, the testing. And then we pulled all the way back and surveyed. And we looked at physicians, laboratories, our federal governing bodies, the epidemiologists, the food supply, the farmers, all of this. And what looked like one patient's diarrhea became the story of an entire healthcare system. Yeah, an entire healthcare system. It's so important. This is why I love pathology. I learn about how systems work. I could be behind the scenes. No one sees me, but I'm just doing so many things that are life-changing. Every diagnosis begins with one tiny clue. And sometimes that tiny clue protects an entire community. Medicine isn't about memorizing answers. It's about learning how to follow the clues, like Blue's Clues. I want to thank you guys for joining me today on the Medical Collective. Please make sure to follow, subscribe, and leave a review. All of those things mean a lot. They push us out. We'll be on 2 years, so we need all the support that we can get. Don't forget to visit our website and subscribe to the newsletter. Until next time, I'm Dr. Keisha Davis. Thank you for joining the Medical Collective. Thank you for tuning in to the Medical Collective. We hope today's episode has left you with valuable insights and a new perspective on healthcare. Don't forget, follow us on social media for more updates and behind-the-scenes content. I'm Dr. Keisha Davis, and it's been a pleasure to share this time with you. Stay healthy, stay informed, and we'll see you in the next episode, where medicine continues to meet real life. Please note that the content provided in the Medical Collective podcast, including text, graphics, images, and other material, is for informational purposes only. The content is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified health provider with any questions you may have regarding a medical condition. The views and opinions expressed on this podcast are solely those of the individual authors and guests and do not represent those of the Medical Collective, its staff, and any affiliated entities. The appearance of content on the podcast does not imply an endorsement. Neither the host, Dr. Keisha Davis, the co-host, or any guest of the podcast bear responsibility for the accuracy of the content provided or the use of information received through the podcast. Reliance on any information provided by the Medical Collective podcast, its employees, writers, or guests is solely at your own risk.